Welcome to the VA healthcare system. Thank you for your service to our country. Now it's our time to serve you. Our healthcare team is here to provide you with excellent care. The more you know, the better prepared you'll be. Our goal is for you to be part of our team. We want to decrease your anxiety and make sure you're well prepared for your surgery or procedure. We recognize this is a very important event for you and your family and have developed this video to best prepare you for your surgery. For the purposes of the video, we will be using the word surgery, but this is also relevant to veterans having cardiac catheterizations, biopsies, arteriograms, and any other invasive procedure. You and your doctor have agreed on the need for surgery. Prior to surgery, your doctor will order pre-op testing, which could include blood work, an EKG, a chest X-ray, or any other tests your doctor feels are necessary. All your pre-operative testing will be reviewed to clear you for surgery. Your doctor will also review and obtain your consent prior to surgery. Now let's discuss what you can do to ensure your surgery is being done under the best possible circumstances. Most importantly, stay healthy. Avoid being around people that are ill and use excellent hand washing techniques. Prior to surgery, it's very important to report any changes in your health to your doctor or a member of your healthcare team. These changes could include fever, infection, new injury, or any other illness. In order to help you heal faster and decrease your risk of infection, it's important to cut back or quit smoking. Also, you should know that alcohol and recreational drugs, such as marijuana and cocaine, mixed with anesthesia, can be very dangerous. You should not have any alcohol at all for 24 hours before your surgery. And you must not use recreational drugs for at least 1 week before surgery and anesthesia. Now we would like to give you some instructions that need to be followed the night before and day of surgery. You will receive a preoperative instruction sheet. It will help you prepare for your surgery. It's very important to follow all of the pre-op instructions or your surgery may be delayed or canceled. It's also extremely important that you're on time. Though there may be some waiting involved prior to your procedure, everyone is counting on you to be on time, especially the veterans scheduled after you. Make sure you bring your VA card with you or your picture identification if you don't have a VA card. Do not have anything to eat or drink after midnight prior to your surgery. This includes food, all fluids including water, gum, mints, or hard candy. If you eat or drink, your stomach contents could back up into your lungs while under anesthesia and cause serious complications. It is okay to brush your teeth. On the day of surgery, take only the medications your doctor told you to take. You may take a few sips of water with your medications to get them down, but only a few sips. Here are a few medication tips. Many medications for your heart and blood pressure are important to continue on the day of surgery. If you are diabetic, your doctor or pharmacist will decide which diabetic medication you should stop or continue. It's very important for you to follow these specific instructions provided to you. Blood-thinning medications are often stopped prior to your surgery. A few examples are aspirin, Motrin, ibuprofen, Aleve, Coumadin, also known as warfarin, or Plavix, also known as clopidogrel. These are only a few examples, as there are many more medications that thin your blood. Your doctor must decide what is best for you and your type of surgery. Do not stop taking these medications unless you are instructed to do so. Take a shower or bath prior to coming in for surgery. Bathing can help reduce germs on the skin, thereby reducing the risk of postoperative infection. If you've been given special surgical soap by the nurse, please use as directed. No perfumes, deodorant, powder, or lotion should be used after you shower. You will have to remove all jewelry before going to surgery. This includes rings, watches, chains, and piercings. No jewelry is allowed in the operating room, so it's best to leave it at home to avoid it getting lost or damaged. Come dressed for the occasion in clean clothes. Loose-fitting pants or shorts, a button-up shirt, and slip-on shoes are ideal. Eyeglasses, contact lenses, hearing aids, and dentures will also be removed prior to surgery. Remember, do not use glue on your dentures before coming in. The entire surgery and recovery room process takes about 4 to 6 hours on average. Prepare yourself and your family or friends for this time frame. On arrival, be sure to have your driver's name and phone number to give to your nurse. If you are going home the same day as surgery, you must have someone here to take you home. You cannot take a bus or cab alone, and you cannot drive yourself home. For your safety, your procedure will be canceled if you are going home the same day and do not have a responsible person to accompany you. Upon arrival on your day of surgery, you will be welcomed by a healthcare professional. You will be asked to change into a gown and place your belongings in a bag. You will have your blood pressure checked and answer some simple questions. An IV will be started. In some cases, body hair may need to be removed from your surgical area. Please do not shave your surgical area yourself prior to arrival. Upon transfer to the operating room or procedure area, your family or friends will be shown to the appropriate waiting room. Since it will be a long day for your guests, we encourage them to bring a sweater, a snack, and something to read. Remember, it may be 4 to 6 hours before you go home. After surgery, you will go to the recovery room. If you are going to be admitted after surgery, you will go to an inpatient unit when your room becomes available. If you are going home on the same day, you will return to the outpatient unit to be prepared for discharge. You will be given discharge instructions as directed by your doctor regarding activity, diet, medications, follow-up appointments, and any other information needed for you to feel at ease for discharge. We hope your experience will be a positive one. We appreciate you taking your time to watch this video and hope it better prepares you for surgery. If you have any questions or concerns, please let one of our staff know. We'll be happy to assist you. We wish you a speedy recovery and thank you for allowing us to care for you.